Greetings and welcome to ME180 Week 9 video lecture. What I'm going to do today is just go over a little bit about the general guidelines on specimen collection. I've also placed videos on blood draw for you to view, so you've got some stuff to look at this week. Okay, the general guidelines for specimen handling is that generally the specimen requirements are written in a format that specifies the requested volume, the storage temperature, any handling notes or any special notes. The requested volume is the amount or an amount of sufficient to allow at least 2 performances of the assay, either singly or duplicate. So you need to be able to perform the assay or test either twice singularly or in duplicate. The minimum volume allows one single analysis, including the instrument dead volume. Storage temperature is specified as room temperature, which could be 15 to 30 degrees centigrade. Refrigerated is 2 to 10 degrees centigrade, or frozen is -20 centigrade or colder. When temperature is not indicated, the sample may be stored and shipped in the most convenient way or manner that you have. For panels or multiple assay requests, and remember assay means test request, the sample should be submitted with the physician's priority of determination on the test request form. Tests will be performed in the order of that priority. If the volume is insufficient to run all the tests requested, the client services department will contact the physician. And sometimes, we just can't, for instance, blood, we can't get enough blood. The veins aren't large enough for us to enter, and we have to go at it in other ways. Okay, the quality of any laboratory test result is dependent on many variables. The first of which begins with you. Your care, skill, knowledge when you're preparing the patient and the specimen are essential to the provision of the highest quality standards for testing and services. Now, the patient must first be properly prepared so that the best possible specimen can be collected. Next, the actual collection of the specimen needs to be completed. Then the specimen should be properly processed, packaged, transported to the laboratory in a timely manner and under environmental conditions that will not compromise the integrity of the specimen. Now, a lot of times working in doctors' offices, you have to ship out the blood to get tested. Some offices have labs, so, especially clinics. So some clinics have labs of their own. So depending on where you work, you may or may not have to ship out. After all these activities take place, a quality analysis can be performed. The specimen collected and handling process can be completed by you and the staff or by referring your patient to places like Quest Diagnostics Patient Service Center. You need to contact the laboratory for clarifications if needed prior to specimen collection. So in other words, they'll tell you what you need to do or how much you need. Specific specimen requirements for each test are listed in the test center. The specimen requirements include information such as specimen volume, collection, transport, containers, as well as transport temperatures we talked about. If additional information is needed for the interpretation of the test results, or there are specific instructions for the patient's preparation, they're listed along with the specimen requirements. It's critical that an adequate specimen volume is submitted for analysis. The volume requested uh, in this directory is enough for the initial analysis as well as for any confirmatory tests that must be performed. Uh, if an inadequate specimen is submitted, we may not be able to perform the initial tests or required confirmatory procedures. So you have to make sure you've got exactly what you need or even a little more to be able to perform more tests. If that repeat test can't be performed, the report will indicate the specimen quantity submitted was QNS, quantity not sufficient for additional testing. When serum or plasma is to be submitted for analysis, it's a good practice to collect a volume of blood that is 2 to 2.5 times the volume of serum or plasma needed for the test. For example, if 4 milliliters of serum or plasma is needed for the test, you need to collect 8 to 10 milliliters of blood. When an inappropriate specimen or unclear test request has been submitted, you'll receive notice or notification with instructions for resolving the problem, which means you will probably have to repeat the test. Health and safety precautions. You use these precautions when you're handling specimens containing blood or other potentially infectious material. Work areas contaminated with blood or serum must be disinfected immediately with 10% bleach, hydrochloride at 5% final concentration, so that's 10% bleach, or any other approved disinfectant, hospital grade. In event of an exposure, administer first aid immediately, notify your manager or supervisor, and seek prompt medical attention. First aid includes washing cuts, needle sticks with soap and water, flushing splashes that went into the nose or the mouth or the skin with copious amounts of water, and identifying, anything that has gone into the eyes, irritating the eyes, clean with clean water, saline, or sterile irrigants. The specimens must be handled in a safe manner according to the applicable legal requirements or guidance. Information on safe specimen handling may be obtained from the U.S. Occupational Safety and Health Administration, or OSHA, and the Centers of Disease Control and Prevention, or CDC. In handling human specimens, the goal is to protect healthcare workers and ancillary staff, such as transportation, as well as the general public from exposures to blood and other potentially infectious body fluids. Besides following other specimen preparation procedures included in this little discussion we're having, customers should, prior to sending a specimen to Quest Diagnostics, ensure that there is no leakage from or visible contamination outside the specimen container, and that there are no needles or other sharps in the package that could cause injury or pathogenic exposure to anyone handling or opening the package and inner containers. Quest Diagnostic reserves the right to refuse to accept any transports that might pose a safety hazard to its employees. Preparing the patient. There are many tests that require that the patient be prepared in some specific way to ensure that you have useful results. The best analytical techniques provide results that are only as meaningful as the quality of the specimen that has been submitted for the analysis. Your goal is to provide the goal is to not provide the goal is to have you provided with the most useful diagnostic information possible. I'll spit that out there in a minute. Um, if you have questions about the patient preparation of any test, find out. Ask for assistance. Fasting. A lot of times you have the patients fasting. For a majority of tests performed on serum, plasma, or whole blood, a fasting specimen is preferred. Non-fasting specimens often contain fat particles that can interfere with a lot of the analytical procedures. And fasting is defined as no consumption of food or beverage other than water for 9 to 12 hours before testing. It's important to indicate and helpful to indicate the patient age and blood type so that the appropriate reference ranges can be assigned for reporting purposes. On occasion, patient age will assist the technologist in choosing the appropriate initial sample dilution for the assay. Pediatric specimens, their color-coded Vacutainer tubes are provided to facilitate special handling. Special small conical tubes with screw caps are provided to prevent evaporation of small volume amounts. They hold up to 1.5 milliliter of specimen. The standard specimen transfer tubes should be used for larger volume samples. For urine specimens, use urine vials. And if you're sending them out to Quest Diagnostic, then you contact them for information about supplies that will be needed. Generally, they request 1 tube per test to avoid delays in processing and to expedite turnaround time. To minimize specimen volume requirements for small children, however, only 1 tube is required when multiple tube tests are ordered. When dealing with pediatric specimen tubes, you wrap the label around the tube just below the screw cap so the ends of the label adhere to each other and the information stipulated above it can be read. Bright orange self-adhesive pediatric sample labels are provided. Place one of these labels in a blank area of the test request form. The test request form is properly filled out and labeled, and it should be folded and inserted into the pediatric specimen bag. I'm going to talk a little bit about identification of specimens. Your specimen labels should, and all specimens should be labeled with at least 2 patient identifiers. The patient's name, full last name, full first name or initial, or a unique ID code is always required. The second patient identifier can be date of birth, month, date, year. It could be unique patient identifier that's also on the test requisition, hospital or office ID code or file number. Quest Diagnostics requisition number or specimen barcode label. Other barcode labels can be used if the barcode matches the unique identifiers on the printed requisition. Now, the barcode does not need to be human readable. I hope this has given you a little look into specimen collecting and how the care that you need to take. We have 1 more week left to go, and I look forward to reading your discussion questions. And please, 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 please sign on and make replies several times. Some of you are only writing 1 to 2 sentences for discussion questions. That's not discussion. I was informed of that this week. You have to give a decent amount for it to be discussion and to be reply. So please do so. Sign on several times And when you sign on several times and do something online, you'll also get your attendance. Isn't that great? All right, have a great holiday, and I will talk to you later. Thank you.